Hi, my name is Ramo Naidu. I'm an anesthesiologist and pain physician. I work here in the San Francisco Bay Area in Marin County. Before I was introduced to the BIOTRONIK remote care monitoring and programming, spinal cord stimulation looked very different. In the post-implant phase of care, although I wrote documents in which I wanted patients to see me 6 weeks, 6 months, every year, a lot of my patients never returned to see me, to be frank. Out of sight, out of mind wasn't necessarily good back in the day. So having an ability to monitor programs is a significant step forward in the entire field. So proactive care is standard with every Prospera spinal cord stimulator. Patients get access to remote programming and monitoring. BioVantage is an optional extra layer of care that I think some patients should certainly consider. These would be patients who may have higher demands or higher needs for all sorts of reasons, whether it's purely social, if it's psychological, or if they really have a complex pain physiologic issue in which they need more touch points. That's really where BioVantage is gonna be an advantage.
So these month-to-month calls allow us to build a better relationship. It allows our conversations to be more personalized, truly understand what a patient wants, and offer the support that they need. And the great thing about the program is that it's tailored by their physician, and we have visibility to their stimulators data. These month-to-month calls help reduce the anxiety of stress of not knowing how to use their system and helps them build confidence and empowerment for themselves.
When I text them and I call them and I say there's a problem or whatever it is, they're right there for me. And that's really important. You know, I need someone to talk to every single month, to check in, to tell them, to set different goals. So yes, I need a care team member, and they're the most helpful.
What I've noticed is I'm not brought down or burdened by all those little issues, yet the satisfaction from patients has been so much higher than I've ever seen it before. If there's any issue, they know to contact the Embrace care team, they're staying within the therapy, and quite frankly, they come back just loving their devices. It's not just like I like it and it's working and it's giving me, 50 or 60% relief. It's like, I love this thing. It's changed my life. I know these check-ins are always gonna be happening every single month. And so that gives me confidence, that gives me peace of mind.
The monthly program gives me encouragement, it gives me guidance, and it gives me hope. It's something I really rely on. It's something I look forward to. I can't imagine not being able to talk to one of the care team members about my situation. I just can't.
If I look at my schedule on a daily basis as far as my clinic, you really want to look at it and see how you can optimize care. Now, that means getting new patients in, getting high yield interventions when necessary, reducing your wait list to the greatest degree possible. That's really where BioVantage eliminated a lot of those unnecessary visits so that I can get those higher yield visits in. So I would say productivity has increased even though the amount of time I spend on a single day hasn't changed.